Fatty liver disease is a serious condition that may have far-reaching consequences for a person's health. Even though it begins with the accumulation of fat in the liver, if it is not identified and treated in a timely manner, it may potentially lead to conditions that are life-threatening, such as liver cirrhosis. Since, in its early stages, it does not always show noticeable symptoms, it affects a large number of people. Approximately 30% of the US population has some form of chronic fatty liver disease. In today's video, we are going to discuss what happens to your body when you have fatty liver disease. If you are well aware of any slight changes that happen to your body due to a fatty liver, it may help to mitigate the health risk. Let's get started. What are the primary types of fatty livers? To understand better what fatty liver does to your body, you should understand its types and differences. Fatty liver disease primarily consists of two main types: non-alcoholic fatty liver disease, NAFLD, and alcoholic fatty liver disease, AFLD. These two types have different underlying causes and associated risks. 1. Alcoholic fatty liver disease, AFLD. AFLD occurs in individuals who consume excessive amounts of alcohol over an extended period of time. It is characterized by the accumulation of fat in liver cells, similar to NAFLD, but it is directly linked to alcohol consumption. In addition to that, AFLD may progress to more severe alcohol-related liver diseases, such as alcoholic hepatitis and alcoholic cirrhosis, which may be life-threatening. It's important to note that while alcohol is a primary factor in AFLD, it may also contribute to or exacerbate NAFLD when consumed excessively in individuals with both risk factors. 2. Non-alcoholic fatty liver disease, NAFLD. NAFLD is the most common type of fatty liver disease and occurs in individuals who consume little or no alcohol. Consuming a diet high in refined sugars, unhealthy fats, and processed foods may contribute to this condition. In addition to that, leading a sedentary lifestyle and not getting enough exercise may play a significant part in the development of the risk of non-alcoholic fatty liver disease, NAFLD. Insulin resistance and type 2 diabetes are two other conditions that are frequently associated with it. It is important to keep in mind that NAFLD frequently occurs in conjunction with metabolic syndrome, which is characterized by high blood pressure, high cholesterol levels, and abdominal obesity. NAFLD may be of different types, from simple fatty liver steatosis, where fat builds up in liver cells, to non-alcoholic steatohepatitis, NASH, which causes inflammation in the liver and could damage it. Further, NASH may progress to more severe conditions, including fibrosis, cirrhosis, and liver failure. 8. Liver cancer. Fatty liver disease, particularly NASH, is associated with an increased risk of developing liver cancer. Chronic inflammation may cause DNA damage and mutations in cells due to oxidative stress. Apart from that, inflammatory signals also prompt the rapid division of cells, which may increase the chances of genetic errors occurring during DNA replication. This uncontrolled cell proliferation may lead to the formation of a tumor, which may have the potential to grow malignant in the future. Antioxidants in green tea, such as EGCG, may neutralize harmful free radicals in the body. EGCG has also been shown to stop enzymes like COX and LOX from working. These enzymes help inflammatory mediators. By blocking these enzymes, green tea compounds may help reduce inflammation. A prospective cohort study on 175 females aged 40 years and over, during a course of 10 years living in Saitama Prefecture, Japan, revealed that drinking 10 Japanese-sized cups, 120 milliliters per cup, of green tea per day delayed cancer onset by 7.3 years for female patients. 7. Liver cirrhosis and liver failure. In severe cases, fatty liver disease may progress to cirrhosis, a condition where the liver tissue becomes scarred and non-functional. The damaged liver is less effective at performing its essential functions, including metabolizing toxins and regulating hormones. This may lead to a wide range of symptoms and complications, including jaundice, easy bruising, and susceptibility to infections. Cirrhosis may ultimately lead to liver failure, which is life-threatening and may require a liver transplant for survival. For individuals with advanced liver disease, a diet that is low in sodium and easy on the liver is recommended, according to a study. Cirrhosis may cause fluid to build up in the legs and abdomen, called edema, and in the liver, known as ascites, because the liver is not working as well. Sodium may contribute to fluid retention, so reducing its intake helps decrease the amount of excess fluid the body holds. Typically, individuals with cirrhosis are advised to restrict their sodium intake to around 2,000 to 2,500 milligrams per day. 6. Increased risk of cardiovascular disease. Fatty liver disease is linked to an increased risk of heart disease. The inflammation and insulin resistance associated with the condition may contribute to high blood pressure, elevated cholesterol levels, and a greater likelihood of developing cardiovascular problems. Earlier in this video, we explained that NAFLD is often associated with insulin resistance, a condition where the body's cells become less responsive to insulin. Now, this resistance may lead to elevated blood sugar levels and an increased risk of type 2 diabetes, which is a significant risk factor for heart disease. In addition to that, NAFLD is linked to changes in lipid metabolism, including higher levels of triglycerides and lower levels of HDL cholesterol. This altered lipid profile is associated with an increased risk of atherosclerosis, the buildup of fatty plaques in the arteries that eventually puts your heart at risk. To mitigate the degree of danger, you may choose foods that are heart-healthy, such as fatty fish like salmon. Omega-3 fatty acids in salmon may improve insulin sensitivity, contributing to a better heart condition. In a study with between 263 and 1,132 participants, both children and adults with NAFLD took different amounts of omega-3 preparations every day for 3 to 25 months. The amounts ranged from 0.25 to 6.8 grams of oil. It has been proven that omega-3s lower triglycerides in the blood, which lowers the risk of heart disease. 5. Fatigue and weakness. Chronic fatigue and weakness are common in individuals with fatty liver disease. Its reduced ability to process nutrients may lead to anemia and a general feeling of tiredness. Moreover, fatty liver disease has been linked to sleep disturbances, including conditions like sleep apnea. Poor quality sleep or sleep disorders may cause daytime fatigue and excessive sleepiness. Apart from that, fatty liver disease is often associated with obesity and a sedentary lifestyle, both of which may independently contribute to fatigue. Carrying excess weight may strain the body and lead to reduced energy levels, while physical inactivity may result in deconditioning and reduced stamina. To improve your stamina, you may practice a change in diet. High-fiber foods are typically less calorie-dense and may help promote feelings of fullness, reducing overall calorie intake. This may assist in weight management and potentially lead to weight loss, which is important to treat NAFLD. 4. Unexplained weight loss. Some people with advanced fatty liver disease, particularly non-alcoholic steatohepatitis, NASH, or cirrhosis, may experience unexplained weight loss. This may occur due to a loss of appetite and the body's increased energy expenditure as it tries to repair liver damage. You may already be aware that fatty liver disease may cause symptoms like abdominal discomfort, fatigue, and nausea. These symptoms may lead to a decreased appetite, as individuals with these symptoms may not feel like eating or may experience discomfort after a meal. Over time, this reduced calorie intake may result in weight loss. In addition to that, fatty liver disease is often associated with insulin resistance, a condition in which the body's cells become less responsive to the effects of insulin. Insulin resistance may affect how the body processes and stores nutrients, including glucose and fat. It potentially leads to fluctuations in blood sugar levels, which may affect appetite and energy levels, potentially contributing to weight loss. 3. Pain and discomfort. Individuals with fatty liver disease may experience discomfort or pain in the upper right side of the abdomen, where the liver is located. This pain may vary in intensity and be described as a dull ache or a feeling of fullness. Earlier in this video, we mentioned that fatty livers often cause liver enlargement. An outgrown liver may also press against neighboring structures in the abdominal cavity. For example, it may put pressure on the gallbladder, which is located just beneath the liver. This pressure may cause discomfort or even lead to gallbladder issues and pain. Additionally, the liver is positioned below the diaphragm, and pressure from an enlarged liver may irritate the diaphragm, resulting in referred pain to the right shoulder or upper back. In some cases, fatty liver disease may progress to more advanced stages, such as cirrhosis or liver fibrosis. These conditions involve significant scarring and damage to the liver tissue. Aside from other symptoms like jaundice, yellowing of the skin and eyes, fluid retention, and gastrointestinal bleeding, severe liver damage may also cause persistent and severe abdominal pain. 2. Enlarged liver. Hepatomegaly. In some cases, fatty liver disease may cause the liver to grow more than its normal size. A healthcare provider may detect an enlarged liver during a physical examination. Several things may damage the liver, including infections like hepatitis and mononucleosis, liver tumors, which may be benign or malignant, metabolic diseases like hemochromatosis and Wilson's disease, congestive heart failure, and alcoholic liver disease. In the context of NAFLD, hepatomegaly often occurs as the liver attempts to process excess fat and deal with inflammation. It may increase in size. Impaired liver function. In NAFLD, excessive fat, primarily triglycerides, accumulates within liver cells called hepatocytes. These cells are responsible for various crucial functions, including detoxifying the blood, metabolizing nutrients, and producing essential proteins like albumin and clotting factors. This fat buildup may hinder the normal functioning of hepatocytes. You may be aware that certain types of dietary fiber, like soluble fiber, may bind to dietary fats and cholesterol, reducing their absorption in the intestines. This may potentially lower the amount of fat delivered to the liver, reducing the risk of fat accumulation. In a 2-month study with 44 patients with non-alcoholic fatty liver disease, those on a low-carb and high-fiber diet showed significant improvements. They experienced reduced body weight, body fat, abdominal size, insulin resistance, and improved metabolic indicators such as liver enzyme levels, blood glucose, blood lipids, and uric acid. What are the preventive measures for fatty livers? Preventing fatty liver disease, especially non-alcoholic fatty liver disease, NAFLD, involves adopting a healthy lifestyle and making choices that support liver health. Here are some key steps to help prevent fatty liver disease. Eat a balanced diet. A diet rich in whole foods, such as fruits, vegetables, whole grains, lean proteins, and healthy fats, provides essential nutrients while minimizing the intake of empty calories and unhealthy fats. This balanced approach to eating supports overall health and helps prevent the buildup of fat in the liver. Exercise regularly. Physical activity helps burn calories, reduce body fat, and improve insulin sensitivity. Regular exercise also supports cardiovascular health, which is closely linked to liver health. That's why incorporating both aerobic, like walking, jogging, and strength training exercises into your routine is beneficial. Avoid rapid weight loss. A condition known as starvation steatosis is a form of fatty liver disease that may be caused by going on crash diets or losing a significant amount of weight very quickly. If you need to lose weight, it is absolutely necessary to pursue weight loss methods that are gradual and sustainable to avoid the danger. Seek professional guidance. If you are uncertain about how to prevent or manage fatty liver disease, consulting with a healthcare provider or a registered dietitian may provide personalized guidance and recommendations based on your specific health needs and circumstances. Maintain a healthy weight. Excess body weight, especially around the abdomen, is a significant risk factor for fatty liver disease. Carrying excess fat may lead to fat accumulation in the liver cells, contributing to the development of a fatty liver. Achieving and maintaining a healthy weight through a balanced diet and regular exercise is crucial for reducing this risk. Control blood sugar. Keep in mind that elevated blood sugar levels and insulin resistance are associated with fatty liver disease. Managing blood sugar through a combination of diet, exercise, and, if necessary, medication or insulin therapy is essential to mitigating the risk of NAFLD. Limit alcohol consumption. Excessive alcohol consumption is a well-known cause of alcoholic fatty liver disease, AFLD. To prevent AFLD, it's important to limit alcohol intake to moderate levels, which typically means up to 1 drink per day for women and up to 2 drinks per day for men. Manage other health conditions. You are already aware that conditions like high blood pressure, high cholesterol, and metabolic syndrome are associated with an increased risk of fatty liver disease. Hence, managing these conditions through medication, lifestyle changes, and regular monitoring may help reduce the risk. Exploring the effects of fatty liver on the body reveals the importance of vigilance and proactive health management. Fatty liver is not merely a benign condition. It's a silent threat that may silently wreak havoc on your liver, metabolism, and overall well-being. By gaining awareness about the potential consequences and taking steps toward a healthier lifestyle, you may empower yourself to protect your liver and ensure a healthier future. If you suspect you may have a fatty liver, it is essential to consult a healthcare professional for a proper diagnosis and guidance on managing your liver health.